Hey guys, it's Jesse, the Alabama chiropractor. Today I'm going to talk about pediatrics, pregnancy, and chiropractic. I actually got the opportunity yesterday to speak in public for the first time as a doctor, and I addressed an event, an expo here in Daphne, Alabama called Baby Palooza. It was a lot of fun. I had a couple dozen pregnant moms and their supportive family members who were able to kind of listen in on a 15-20 minute talk about how chiropractic care can benefit pregnant patients and in certain circumstances pediatric patients. So if those are things that are of any interest to you, stay tuned for a couple of minutes and I'll talk more about it. So when it comes to pregnancy, I know most people have never considered chiropractic care and pregnancy being congruent. And when it comes to pediatrics, I think that even more so, most people have never even considered chiropractic care for young children, pediatric patients. The fact is that for over 30 years now, there's been one specific technique that's been used in chiropractic care. It's called the Webster technique, and it's extremely beneficial for pregnant patients, especially patients who are suffering from any kind of pain, whether it's joint pain, muscle pain, nerve pain, down in the pelvis especially. There are a tremendous amount of changes that are going on when a woman becomes pregnant and goes through the whole development of a new life inside of her. And so some guidance of those changes with chiropractic care can be extremely powerful when it comes to helping the muscles balance out, keeping the joints of the body moving properly, working properly, and obviously making sure there's as little pain as possible throughout the entire process. So if you have pain and you are pregnant, if you know somebody who's pregnant and has some low back pain, shooting pain in the legs, achiness, anything like that, I highly recommend you go talk to a chiropractor about it. The fact is that more than likely you can get some relief with just a few simple, powerful adjustments from a chiropractor who's been trained with the Webster technique. When it comes to pediatric care, a lot of parents are really leery of taking their child to a chiropractor because when you see videos on YouTube or when you experience chiropractic, obviously with adult patients, we crack the spine, which I hate that term, but I'm going to use it. And that scares a lot of people, let alone allowing their child to have their spine cracked. So what I wanted to say first is that when it comes to pediatric patients, the treatment looks night and day different from an adult patient. Child patients, pediatric patients have very specific needs for their bodies as they develop. Chiropractic care for pediatric patients is centered on making sure the body is functioning correctly. And when we do adjust, it's very gentle. It's very much more about creating movement in a gentle way rather than any sudden, treatments or adjustments. Chiropractors are also good with nutritional counseling, exercise counseling, physical therapy needs, a few treatment or a few diagnoses that chiropractors can help with pediatric patients are things like torticollis, which is where one side of the neck becomes suddenly rigid or stiff, the muscles spasm, and it can cause a lot of pain. It can cause pain for weeks on end. Chiropractic care has been shown to be pretty helpful with reducing the time and intensity of torticollis symptoms. Another thing is colic. No parent wants to go through days or weeks or months of a baby who's constantly fussing, constantly crying. And as a chiropractor, obviously it breaks my heart that any child would be in that situation to begin with. There's not a lot of research linking torticollis with musculoskeletal problems. And as a musculoskeletal expert, that's what I treat. But there have been some case studies with chiropractic and colic that have shown chiropractic care to be really beneficial in helping reduce those symptoms. So those are kind of the major points that I hit on with my talk. Thank you for paying attention, listening in. Once more, if you are pregnant, if you know somebody who's pregnant, get into a chiropractor. Just go at least have a consultation and see what possible benefits you might get out of it. Have a good one. Talk to you next time.